Welcome all to Homeomitra Vartaalap. Today's episode is with Dr. Siddharth Desai. He is a young and very fit and dynamic dental surgeon. And we are going to learn a lot about dental surgery, about dentistry and his specialty, maxillofacial surgery in this Vartaalap. Since this is a recorded session, we will be adding his email ID in the description. Should you have any questions at the end of Vartaalap, you can always reach out to him. So welcome Dr. Siddharth to Homeomitra Vartaalap. We welcome you. And to begin today's episode, if you could just tell us something about yourself, about your journey into dentistry.
Yes, Dr. Keyur, first of all, thank you for inviting me on this platform of Vartaalap, and thank you for the warm introduction as well. So, my name is Dr. Siddharth Desai. I am a maxillofacial surgeon by profession, and I also represent India in karate by passion. So, maxillofacial surgery is one of the specialties of dentistry. So, it is MDS, which is done after BDS. It's a 3-year specialty course, which we will talk about in detail as we go along this conversation. And I hope I could answer a lot of your as well as the viewers' queries through this chat session of ours.
Great. So, Dr. Siddharth, tell us something about this field of maxillofacial surgery.
So, in dentistry now, even youngsters and even knowledgeable people, even fellow doctors, I would say, are not aware about the subspecialties that have come up over the last few years. By few years, I mean almost 15 to 20 years. Like people are aware that who is a pediatrician, who is a neurosurgeon, who is a cardiosurgeon. Even a layman is nowadays aware of these terms. But in dentistry, if I ask a fellow doctor as well, an endodontist, prosthodontist, oral and maxillofacial surgeon, the awareness is still less. So I would like to shed some light on it. There are 6 further specialties that come after your BDS. BDS is Bachelor of Dental Surgery, which is a 5-year course. After that, just like in medicine, our colleagues do MD. So dentists do something called as MDS, Master of Dental Surgery, which is a 3-year post-graduation. In that, there are 6 clinical specialties. So all surgical procedures related to dentistry come under the heading of oral and maxillofacial surgery. And it also acts, this branch of dentistry acts as a bridge between the dentistry and the medical branches. It's a bridge between the dentist and the other branches of general medicine. Because in oral and maxillofacial surgery, the first year of post-graduation is completely dedicated to understanding the other specialties of medicine. The base is same. We also study general surgery, general medicine, pharmacology. We have our postings in neurosurgery, in orthopedics, in plastic surgery. So this is one of the branches, oral and maxillofacial surgery, in which I have done my master's. In oral and maxillofacial surgery, we do all procedures, all surgical procedures like a difficult extraction, going to your wisdom tooth extraction, then your jaw fractures, all your facial fractures in road traffic accidents, in road assault cases. So we study the anatomy of entire face and scalp right up to the neck. So now there are further specialties, super specialties coming up, that is the oral oncology. After 3 years of MDS, people are further studying for 2 years, for 3 years. They are studying in oral oncology, which deals with all types of oral and orofacial cancers. Then there is cleft surgery. You know, the kids who are born with cleft palate, a gap between their lips and their palate. So that also comes under this specialty. Then there is further fellowships in advanced maxillofacial trauma. The latest upcoming branch is hair transplants and facial aesthetics. Now, there are people who debate that how a dentist is doing hair transplants or maxillofacial surgery, but a maxillofacial surgeon is qualified and is legally allowed to do these surgeries because he has studied the anatomy of that area, and they are doing further fellowships and courses. They are not directly starting with. So a new branch has opened up into hair transplant and facial cosmetics. Now, this is one of the branches. There are other 5 clinical branches which range from your endodontist. Endodontist is a specialist who just does root canals. For his 3 years of post-graduation, he specializes in different advanced methods of root canals. Then there is a term called prosthodontist. Prosthodontist deals with dentures. They usually replace what we remove, they replace. They make partial dentures, complete dentures, single crowns, implant crowns. Now, dental implants are usually done by oral surgeons, and the rehabilitation part on those implants is done by the prosthodontist. Then there is periodontist, who is a gum surgeon. Then there is pedodontist, specialist for kids below the age of 14 years. Just like there is a pediatrician, there is a pedodontist as well. Then there is someone called as a public health dentist, who works with the government agencies, more popular in foreign countries, but it is upcoming in India as well. They work with the government agencies on how we can improve the general public dental health. And then there is oral medicine and radiologist, who study the oral x-rays, the CT scans, and also help with the diagnosis in difficult cases. One more subspecialty is oral pathologist. So these are some of the branches, some of the MDS, the post-graduation branches in dentistry, which the people should be aware of. And one more, the most technologically advanced, the upcoming branch in dentistry is the orthodontist. The maximum developments technologically are coming in the branch of orthodontics. Orthodontics are basically dental specialists dealing with braces. They help with alignment of teeth. Latest, if you would have heard the term aligners. So the braces here earlier, the braces are slowly becoming obsolete, and aligners are coming in. They are transparent sheets to be worn throughout the day and night, only to be removed during having food. It is very comfortable for the patient. It is not seen, it is invisible, and the treatment is done within 6 months to 1 year. That is the latest upcoming branch. Is dental aligners, and the specialists are orthodontists. So these are some of the branches which I aim to make people aware through this chat session of ours.
You are right. Two things. I mean, the extent of maxillofacial surgery is something that I got to know today. Of what all you can do beyond just the surgical,
Yes.
procedures of the mouth. The remaining three branches I was not aware. One is oral medicine and pathology, oral pathology. Second one is this public health dentistry. There's something very new. And the third
Yes.
one was oral radiology. Because I thought that,
Yes.
CT scan and X-rays and everything that must be done by someone who is an MD radiologist. I mean, why do you need a specialty? Because I have never heard of a specialty which is neuroradiology or something
Yes.
like that.
Yes.
Quite interesting and useful. So while we are doing this, so in the comments, I want people to actually type and tell us if this was something new that you learned today. And I also want you to share this as much as possible with your colleagues. If you are a doctor listening to this, please share it with your colleagues. If you're not a doctor, doesn't matter. You share it with your known ones. All right.
Nowadays, there are some young guys who read it up on Google and come and ask specifically that for my child, I want a pedodontist. Do you call a pedodontist to your clinic? So that awareness in youngsters is coming up, which I'm very happy about.
That's really encouraging to hear. Right. So, Dr. Siddharth, tell us something about the recent trends in dentistry.
Recent trends in dentistry, the one, as I already told you about, is the aligners that are coming up. Apart from that, in general dentistry, overall dentistry is moving towards digital dentistry. Everything that we are doing is moving toward, we hear this word digitalization or AI. So even in the field of dentistry, digital dentistry is coming up. Like if, earlier we used to take measurements with something called a thick gel. We call it alginate, which used to stick on the teeth and on the face of the patients, and very cumbersome to work with for the dentist also. So nowadays we have a small scanner. We can move it around in the mouth, and immediately in front of the screen we get the entire scan, and it is immediate. We can see it live while the scan is happening. So earlier we used to take a measurement with the alginate, which is a soft gel like material, pour it into a dye, then send that dye to the lab, and then if there is a problem, the lab guy used to send it again for repeat. So many appointments, many days. Now we scan it, it is immediately seen by the lab guy. He tells us correct these things. We correct them on the spot. Visits are reduced, the effort is reduced, and the cost is reduced. And this is just one of the examples of dentistry going digital. There are also, now you might have heard about procedures, the complex procedures of dental implants. So
Yes.
there are nerves in the jaw. Sometimes there is something called as the maxillary sinus. So earlier it was very difficult to predict and to place implants, it required high level of surgical acumen. But nowadays, with digital dentistry coming up, you take a CBCT, which is like a dental CT scan, and through that, the lab guys will make you a digital guide, place the guide that acts as a guide for placing the implant. Place the implant, surgery is over within half an hour, very safely and effectively. So overall, the picture is going towards digital dentistry, and also AI is coming up in the dental field.
So don't mind me asking, this sounds sound like an odd question, but do you think AI will ever replace dentistry? Like, in the medical profession, they say it might replace a doctor, although I'm not convinced thoroughly.
So AI won't replace the dentist or any medical professional for that matter, but it would in fact help a medical professional. Like I also do hair transplants. So in hair transplants, the robotic have come up. But even to manage that robot, you need a surgeon sitting there. It reduces the surgical fatigue. It is more precise and accurate. But a human being cannot leave himself or herself in the hands of a machine, especially in the medical field. So for me personally, it is always going to be helpful. It is not going to replace. So we should not be scared of it. We should adapt to the newer things coming up and make sure that it makes our life easier.
I agree. I agree. Valid point made. Okay. There is something that I've heard called as dental products. So if you can just tell us about what are the latest dental products which are available in the market and useful for the common public, they might not be aware of.
The most common product and the most useful product which I recommend to all my patients and fellow medical professionals is a dental flosser, water flosser, not the one earlier we used to have that thread which we used to clean in between the teeth.
Yes.
It sometimes causes, it is first of all, it is very difficult to use technically. Secondly, it causes injuries to the gums. So a person never used it consistently. But nowadays we have something called as a water flosser. It has a small water tank, fill it up with water and just move it around your mouth. There are some short videos on YouTube. You can master it in one day. And it helps fantastically to clean between the teeth and keep your dental health optimum for a longer period of time. It comes to around 1,500 to 2,000 rupees. It is available on all your e-merchant sites, Flipkart, Amazon. All good companies are making it like Colgate, Pepsodent, Doracura. And it comes with 2 to 3 tips. So with one machine, 2, 3 people can use it at home. And it comes with 2, 3 years warranty. It's a very good device and everyone should use it. At night, people are mostly bored or tired to brush. But if there is a flosser kept next to your wash basin, just 1 minute and your oral health is taken care of.
Quite useful and handy, I guess. And I can only hope that it will prevent the number of visits to the dentist.
So just like a policeman focuses on a crime-free society, dentists and medical professionals should also focus on a disease-free society. So that we have to work less over a longer period of time.
I agree with you on that point. Yes. Okay. So how has your life been as a maxillofacial surgeon?
Life as a maxillofacial surgeon is very interesting because it is the only branch of dentistry which deals with emergencies. Like someone falls down, bleeding cases, road traffic accident cases. This is the only branch of dentistry which I think gets calls at midnight. Other fellow dentists get stuck in some cases sometimes. They try to extract a tooth and there is uncontrolled bleeding. So at that time, first of all they call a oral and maxillofacial surgeon. So life is very interesting and it is also very it helps you feel good about yourself that you can help others in times of need. At midnight, if someone is calling you, bleeding is not stopping, you go and help them. It gives you very high level of satisfaction that what you studied is helping others. Money is secondary, but it helps others in times when no one else is able to help them. So it is an upcoming branch. The branch of oral and maxillofacial surgery started after the Second World War, because earlier it was a part of general surgery, but then during the Second World War, because there were bunkers, so when the soldiers used to fight out of the bunkers, they used to have maximum facial injuries. Only the facial part was exposed. That is when they branched out they made a new branch called oral and maxillofacial surgery. And even now, newer technologies, newer something or the other upgradation is always coming up in this field.
So,
This field is always under, like my research topic during my post graduation was something called obstructive sleep apnea.
oh, okay.
So obstructive sleep apnea, if I tell you in brief, mostly obese guys above 50 years of age, hypertensive, with large tongue or with the smaller lower jaw, when they sleep, they are not able to inhale oxygen to their full capacity.
Correct.
And in also oral and maxillofacial surgeon steps in cases where the jaw is affecting it, the lower jaw is behind or is small in size. We do a surgery where we put the lower jaw in front and plate it there in the new position. That increases the airway space. This many people are not aware of, that a maxillofacial surgeon can do this procedure.
I mean, let alone that we know about maxillofacial surgeon. I mean, sometimes, I mean, obviously, OSA has got multiple differential diagnoses, one of which is the anatomical
Yes.
cause of OSAs. But yes, this is something which is useful both for patients who are suffering from OSAs. The reason I'm saying this is why patients should also be aware is because nowadays, at least in my practice, I take the patient as a person who is, a stakeholder in his own health and well-being.
Yes.
And therefore, this series of Vartaalap where even patients become aware of what is it that they can do to improve their health. Because, people for years together get, okay, there is snoring and, daytime the patient is sleeping, but there is a
Yes.
lot of, bad health that follows this illness. And if something
Yes.
like this can actually give a lifelong, I mean, it's an anatomical
Solution.
problem,
Yes.
structural problem, and which can be corrected.
Yes.
Something which should be
Yes.
highlighted and not just highlighted, there should be massive health education about this.
Yes.
Right.
Definitely.
So, how is your daily routine? Because, like you said, you are representing India in the sports of karate.
Yes, I have represented India twice in karate, in 2015 and in 2019. And I am a third degree black belt in the Japanese style of karate.
Mm-hmm.
Also, I am training 2 to 3 times in the week. So mostly, if you know the doctor's lifestyle, the timing starts usually after 9 or 10 a.m.
Correct.
So the mornings are free. So I wake up early around 6 o'clock. Then my 2 hours are dedicated towards fitness. Thrice a week, I am training in karate. Other 3 days, I am either walking, cycling, or swimming. And from 10 to 2 is work hours. After 2 o'clock, afternoons are meant for rest and lunch. In evening, again, I start from 5 and I work late till 9 o'clock, which I would like to change over the longer run. But since I stay in an area called Borivali, it is more of a residential area and people go to offices. So by the time they come back from offices, it's already 7, 7:30. And then they could come to the clinic on weekdays. So I have to keep open till 9. But in the longer run, somewhere I would like to work 9 to 5. And then after 5, I would like to dedicate the time to my health and my family. Slowly, maybe over a period of years, I can do it. I hope I can do it. So mornings are for fitness, then work, then afternoon some rest, evening again work, and then after 9 I try to cut off completely from work and try to do some leisure activities after dinner, go for a walk or maybe read a book. Also, I try to limit my social media.
Sorry?
I try to limit my social media exposure.
No, that's a great message. And one thing I don't know. I don't want to kind of say that sportsmen have better disciplines and those who are not sportsmen don't have better discipline. But certainly, even you are still active into sports, uh, training 3 days a week, and then remaining 3 days you are having some other physical activity. Any take-home message for doctors who are not into sports?
So doctors, I think my fellow colleagues, most of them ignore their own health. They work very hard, and at the end of the day, we feel that we worked a lot. But you have to remember that you work sitting in a chair. So your brain has worked a lot, but ultimately you've not burnt any calories. So most of my fellow colleagues, surgeons, they have knee problems, back issues, spondylosis issues. So if we are fit and healthy, we will be able to treat the society in a better way. And also, I have seen the society looks up to doctors and their lifestyles. So what the doctor is doing, and they try to copy it. So we should be role models for the society. And for that, at least 1 hour a day we can dedicate. Even if a doctor is not into sports, at least 1 hour, if he or she makes a habit of a morning walk, it can lead to a sustainable change over a longer period of time. Maybe wake up 1 hour early, or even if they have families, if they have to look after kids, then maybe at night after dinner, you can get down and walk for 1 hour. So small habits done over a longer period of time consistently, that is important for doctors. As I said, we should be role models for the society. We cannot ignore our own health. And if any doctor would like to connect on this topic with me, anyone wants any help, they can always mail me. I can make their entire schedule and diet plan for them for free.
Dr. Siddharth, does it ever occur to you to sort of start a program for doctors, to at least have some basic level of fitness? I mean, I am seeing young people, including doctors, who are having high levels of uric acid, high HbA1c, lipid profile is deranged, the entire metabolic syndrome.
Absolutely. But one more problem is doctors don't get sunlight because our work hours are such, we do not get sunlight. So I have approached the medical bodies many times. I have done a program at IDA, Indian Dental Association, for women doctors for self-defense. Also, I had approached Borivali Medical Brotherhood if we can do something for doctors on regular basis. But somehow they have been very lax in their approach. And in Bombay, if you know, the main problem is infrastructure. Even if I am willing to teach, even if some doctors are willing to learn, where to teach becomes a problem. So through this media, I would like to tell if anyone has some space in and around Borivali, which we can utilize twice a week or thrice a week, I would be very much willing to train doctors to look after themselves.
Would a Zoom class work? I mean, does it help? Like how
Zoom
they do
class would
yoga?
work from my end, but my observation is that Zoom class people are not that consistent. When it is offline, and when people have to get up, get ready, and come, it sort of instills a sense of discipline in them. At Zoom, they just wake up, and sometimes the video is off, and I am teaching, so it becomes a bit irregular.
I agree. I agree. So let's hope that someone is listening to this, and uh, we definitely get a impetus in,
Space.
yes, learning how to remain fit as a doctor. And of course, otherwise also, I'm saying that everyone should remain fit, not just doctors.
Yes.
Uh, how should a doctor balance passion and profession? So I have seen doctors who are, if you ask them, what do you like? So some doctor would tell me that I like reading. Someone would say, I like singing. And this is a very subtle thing to do. I mean, I'm not saying they will not like their medical profession, but they always have a certain passion that goes along with them. They are sometimes not able to balance that. And I see that you have been balancing something that you were doing before you became a doctor, and you're still continuing that. How do you balance it?
All along my studies also I was training. I was at a place called Davangere, Karnataka. So there, to continue my training, I started teaching. So there were many outstation students who used to come from Malaysia to study there. So I had many Malaysian students, many Indian students who were studying there and also training under me twice or thrice a week. So that's how I always continued training. And teaching is the best way to continue training in any of your passion. As you said, how can doctors balance their passions? If they're passionate about something, they should start teaching it. So by teaching, by answering the questions of their students, they can also delve deeper into their art, and that consistency, that discipline of the passion remains. They'll be attached to it at least once or twice a week. Also, as you said it very correctly, doctors are people with maximum curved passions. They have lots of passions which got lost somewhere during their education years. Because most of the doctors study for 8 to 10 years. Somewhere down the line, they lose their passion. And then they try to get back into it, but then they're not that consistent, or they make it a hobby. They don't enter it passionately. So one of the things that they can do is start teaching at least one or two other people. That way they can stay connected.
Agreed. That was a good one. That was a good one. And I hope that people who are listening to this, the doctors particularly, get inspired by this and actually pursue their passion. Trust me, passion is something that will keep you alive.
Yes. Keep you alive, keep you grounded, and keep you balanced. Sometimes the work stress becomes so much that you feel lost. Even when you are surrounded by people, you feel lost somewhere. So at such a time, your passion helps you, brings you back into reality. It keeps you on track. So whatever it is, singing, dancing, or being in the nature, one should at least allocate 2 days in the week to their passion.
Agreed. Yes.
Because
Okay.
fitness is not only physical, fitness is also mental, emotional, spiritual. Everything is fitness.
Agreed. Yeah, the holistic aspect of fitness. True. Now we are going to come to two very tricky questions. The first one is, people find dentistry very costly. How would a dentist justify that? Why is dentistry so costly? And the second question which would follow that is how to choose a good dentist.
Okay. So yes, even myself, I find dentistry very costly.
Okay.
When even myself, I think that some of the procedures like a dental implant, if someone from my family needs two dental implants, it takes almost 60 to 70,000 rupees, which is too much. But then why it is costly? So I'll tell you, starting right from your education of 8 to 10 years. So a person is giving his youth, those 8 to 10 years of his youth, he is dedicating to learn the art which can help you in delivering that dental treatment. Secondly, after that comes, in a city like Bombay, comes real estate. Everything is so costly. To set up a clinic after the education, no one is helping you. The government is not helping you. You still have to take a loan, you have to pay the EMI. So the real estate is so costly. The clinic rates, the rents are very high. Then comes your manpower. In a city like Bombay, again, people expect a decent amount of salary, and you need at least two assistants in a good clinical setup. So all that cost, the light bill. So these are some of the infrastructure costs. After that, the materials that are required in dentistry are costly. Nowadays, government has also started levying GST on dental materials. Also, the dental labs. Government has started levying GST on the labs as well. So that 18% GST has added to the overall costs. So right from education to infrastructure to those lab charges to the material charges, I think this is the only branch of medicine where so many other factors are involved, like the dental material, the lab, and then coming to your dental health. So dental area is one such area which is always populated with microorganisms. And we don't know what the patient is going to eat, what is his lifestyle after going home, if he or she is smoking, or what are the habits. So taking all that into consideration, you cannot use substandard materials. You have to use the best. And in while using the best, the cost might go up. Like for example, as I gave you an example of a dental implant. So dental implant has to be of a material called titanium for it to survive in an atmosphere like the oral cavity. We cannot use any other material which is cheaper. Just because it is cheaper, just to reduce the cost, we cannot use it. We have to stick to certain standard materials. So all these factors contribute to high dental costs. And then coming to your costing, another thing is dentistry is not costly. Your neglect is costly. That neglect starts from your dental fear. People are scared of going to a dentist, of the pain, of the drill. Now it is very technologically advanced, but the stories that we have been hearing from our parents and grandparents, at that time it was not so advanced and it was painful. But nowadays you should come and see for yourself. It has become extremely painless and very fast. So a normal dental thing, see, I would show you on the model. If you see a small black colored discoloration like this,
Mm-hmm.
it is a sign that you should see a dentist. One small black discoloration is actually the bacteria. So if you are used to seeing the dentist every 6 months, if you or the dentist notice that okay, this tooth has started getting decayed, if you notice it instantly, immediately after it has started happening, it can be cured with a small simple filling which takes 15 minutes and around 1500 rupees. Now if you ignore that at that stage and wait for it to increase, it is going to cross the dental layers and reach your dental nerve when it will start paining. Once it starts paining, you see the dentist. Dentist cannot start the treatment immediately. He will give you some medicines to ease the pain off. After 2 3 days, he will have two options. One is a root canal, in which he removes the nerve and replaces the tooth structure with an artificial cap. So the cost increases right from 1500 to 15,000, right from 15 minutes to almost 150 minutes. Why? Because you neglected it in the first place. You did not go for a routine checkup, or you did not notice it in your mouth. You waited for it to pain. दुखेगा बाद में जाएंगे डेंटिस्ट के पास. तो आपका कॉस्ट भी 10 टाइम्स हो गया, आपका टाइम भी 10 टाइम्स हो गया, और आपका ट्रीटमेंट भी लंबा चलेगा. या तो फिर अगर वो इतना हद तक, वो पेन को भी कोई लोग मेडिकल स्टोर में जाते हैं कि आई विल गो टू द मेडिकल स्टोर, मेडिकल वाला दवाई दे देता है पेन किलर, दैट पेन लास्ट, वो पेन दब जाता है 4-5 दिन में, and then it again pains when the infection rises again after 6 months. At that point, the dentist has to remove the tooth because दांत का स्ट्रक्चर ही नहीं बचा है अभी अंदर. तो दांत निकाल दिया, वापस अभी उसमें कुछ नया दांत बिठाना पड़ेगा. Comes your dental implant, so that 15,000 has gone to 30,000. That 150 minutes has gone to 15 days. है ना, almost 3 months. A dental implant procedure, if you do it properly, it takes 3 months to rehabilitate that single tooth. आपका टाइम, डेंटिस्ट का एफर्ट, द रिसोर्सेज रिक्वायर्ड, सब कुछ बढ़ गया. सो मेन रीजन क्या है बढ़ने का? डेंटल कॉस्ट इज हाई बिकॉज ऑफ द पेशेंट्स निग्लेक्ट. इफ यू स्टार्ट गोइंग टू द डेंटिस्ट every 6 months, be more aware about our dental health, then the cost will drastically reduce. And we in India don't go because we don't have dental insurance. In foreign countries, they have dental insurance. In India, it is yet to come. I don't know why it is not coming. The government should take it seriously. They should introduce a dental insurance. Then it will lead to changes, like it will change the dental health overall in a very big way if you have dental insurance.
I agree. I was actually about to ask you the question on dental insurance, but you answered it nonetheless. I mean, it's a painful point.
Sometimes we want to deliver good treatment, but the costs are exorbitantly high to deliver that treatment.
As we are nearing the end of the session, the last question: how to choose a good dentist?
How to choose a good dentist? First of all, do not allow Google to choose a dentist for you. You can go with word of mouth maybe, or you can visit the dentist who is nearby to you. Nearby dentist is very important because dental appointments are usually multiple. So always traveling. If you think that you have to travel a lot, you might end up avoiding going to the dentist. So first factor is choose a nearby dentist. Go to the dentist yourself and see for some of the factors which I am telling. Number one is hygiene. The dental setup should be hygienic. The consulting table, the hygiene starts from the doctor's consulting table. Consulting table should be clean. The doctor should be technologically, he should have all the, if not all, he should have the basic technology required. Basic technology, like the most basic thing that the clinics in a city like Bombay nowadays should have something called the dental RVG, which is a X-ray that can be connected to the laptop, and immediately it can show it to you on the screen, the dental X-ray. At least for 1 or 2 teeth, you can take that X-ray. Then comes dental OPG, which gives a full mouth X-ray. Then comes something called CBCT, but all those are costly affairs. But the base minimum criteria is the dentist should have a dental RVG in the clinic. First point that I told was good hygiene. Then comes how the dentist sees you. The dentist should see you as a whole person. As we earlier also spoke, he should treat you holistically. He should take your dental history. He should also know your medical history, because some of the medical problems like hypertension and diabetes are closely linked to your dental health and treatment perspective as well. Like if a person on blood thinners, I cannot just go and extract his tooth. I need to consult his physician if the blood thinners can be stopped prior, or if the blood thinners cannot be stopped, I should be ready with my armamentarium to stop the bleeding if required. That is where the patient's previous dental and medical history becomes very important. If the dentist is asking about these questions, if the dentist is trying to treat you as a whole person and not just that one single tooth that is paining. After that comes, after the case history examination, The dentist should explain all the procedures that he is planning to do. He should explain what condition you have. He should show you the X-ray. He should explain why it has happened and what is the solution. And also be able to give you multiple options. That these are the solutions. Now you choose. Ultimately, the patient should be the one choosing. That okay, if I don't have a tooth, I can also go with a partial denture. I can go with something called a bridge. I can go with something called an implant. These are the different costs. These are the different appointment times. And this is the life of that prosthesis that we are using. So see if the dentist is giving you good enough time in the consultation. ऐसा नहीं कि आया, हाँ ये पेन है, ये दवाई लो, ये दांत निकालो, घर जाओ. वैसा प्रैक्टिस में try to avoid. Try to avoid Google reviews. Yes, it can help you somewhat. It can give you an idea, but don't trust it completely. Go to a nearby dentist. Look for good hygiene. Look for a dentist who is giving you time, who has the basic technology available. And in today's times, most important factor, go to a dentist who runs his dental setup like a polyclinic. He has other dentists coming in. The earlier branches that we spoke about, he should have all of them on the panel. Because the earlier system where one teacher used to teach all the subjects is over now. Now there are teachers specific to subjects, and for biology there is a different teacher, for maths there is a different teacher. Then when it comes to your body, why are you compromising? For a root canal you should have one MDS endodontist. For your tooth rehabilitation you should have a prosthodontist. For your child you should have a pedodontist. For your gum surgery you should have a periodontist. And for all your surgical work you should demand from your dentist that I want a maxillofacial surgeon to come in and do it. If my wisdom tooth is to be removed, I want the best person to do it, because ultimately it is a surgery and it is my body. So I deserve the best. So the last point is the dentist should have different specialists coming in on the panel. Even if he is doing it, he should have someone available if something goes wrong. I hope that answers all the queries.
Valid point. And extension to your question for the family physician, how, I mean, what is that the family physician should do? Because they see the most number of patients. So, right from head to toe, they see patients for different type of complaints. So what is that the family physician should be mindful of, aware of, and should know when to refer the case to the dentist?
Family physician plays a key role in public health dentistry that we spoke about. Overall, if you want to reduce the dental problems, then the key role here is the family physician. Because even today, if a dental pain is there, the person will first call his family doctor. At which medicine I should take. Then there the family doctor can in emergency they can prescribe a painkiller and antibiotic, but they should insist that okay, at present I am prescribing, but you please go and see the dentist. Because even though the family physician will have some general knowledge on dentistry, dental problems need thorough investigation. It needs a proper X-ray, it needs some test, it needs a proper investigation by a trained person. So family physician can help temporarily, but they should not help over a long period of time. If the patient is complaining of the same pain again and again, and the family physician is giving the same antibiotic and painkillers, then it is wrong. He or she should guide them to the proper place. If you go here and get it done.
Agreed. Including
Also, the family physician should be able to recognize that this is a dental pain. Now, some of the family physicians recently sent me 2 or 3 patients with TMJ pain. Some patients have pain in the joint. So earlier they used to send them to ENT, but now the family physicians are also aware that there is someone called a maxillofacial surgeon who specializes in the TM joint. So there are patients who are coming in directly with reference that I want to show my TM joint to the surgeon. So that awareness should come in for everyone, not just 1 or 2 physicians.
for example, not all bleeding gums are because of scurvy. I mean,
Yes.
In a population which is now, I would not be wrong in saying that overnourished, you may not find bleeding gums as as a vitamin C deficient condition. It could be
Yes.
something as common as a gum condition that is seen in dentistry, which is pyorrhea.
Yes, pyorrhea, and it is very easily treatable. If sent to the right person at the right time, it is very easily treatable.
Well, that was quite an informative session, but a small myth buster that I want you to answer, because I've been seeing these reels often on Instagram. Reason I use Instagram is because my profession, part of my profession is managing social media for homeopathic doctors. So then I see these reels that, they say don't do root canals. Root canals are not good. Those tooth, they harbor bacteria and eventually they lead to uh, oral health problems and even heart conditions which are fatal eventually. Rather than believing them, I would ask this question to you. If as an expert on the subject, you could put some light on that.
It is just to sensationalize the topic that don't do root canal, it is linked to your heart. Because when a person sees while scrolling the reels that something in the tooth is directly affecting the heart, they become aware. And when you use a term like root canal, which a common person is also aware about, they get scared. So nowadays, fear is selling. So there is no base to the theory that root canal can harbor bacteria. It is a dead tooth. See, even if what is root canal? Root canal, we are basically the tooth has a nerve inside. So when the decay crosses all the layers and reaches the nerve becomes inflamed. And when it is inflamed, it leads to unbearable pain. So in root canal, what we are doing is we are removing the nerve and we are replacing it with something called gattaparcha, which is again a natural material. And we are sealing the tooth off. Once the root canal is over, the tooth becomes hollow from inside. Because we have cleaned it from the inside, it becomes hollow. So there are chances that it might break while eating something hard. That is why we cover it with a cap. This is what is root canal followed by a cap. Now in this, the bone surrounding the tooth is still alive. The blood circulation to the bone is still alive. So the tooth is getting the circulation from the bone. Only thing that is dead inside the tooth is the nerve. Blood supply is intact. From the surrounding bone and the gums, the blood supply is intact. And if they are saying that it harbors bacteria, and it is right that a root canal treated tooth might also get infected because the tooth structure is intact. So below the cap is food is getting stuck, then bacteria may be there. Then that we mostly see after 10 years, 15 years, the root canal treated tooth breaks. Because under the cap, the patient cannot see. If he is not cleaning it properly, the bacteria might eat up the tooth and the tooth might break. That is very common. But that is again localized. Any infection, for it to go from your mouth to your bloodstream, it needs some degree of like the immune system is weak.
Yes.
Immunocompromised. Like suppose an uncontrolled diabetic, for him a dental infection can enter the bloodstream and can cause sepsis, but not for a healthy person. Because as I said earlier, your entire oral mucosa has lots of microorganisms, some of which are beneficial to you, some of which cause decay. But root canal per se as a procedure has no connection to your heart because it is not a dead tooth. Only the nerve has been removed and the blood supply is intact through the surrounding bone and the gums.
Thank you for busting that myth, and I hope those who are listening, please don't follow Instagram reels for health education. There are dentists who are seeing this. I'm not seeing a single Indian dentist make a reel like this. These are all foreign dentists. I'm not questioning their competence, but at the same time, what I'm trying to say is don't follow Instagram reels for your health concerns unless it comes from a
Very
doctor.
Very true.
Well, now that we have had this conversation, now I am getting more questions in my mind because you have answered so precisely and to the best of satisfaction. And I'm sure people who are listening to this podcast, sharing with others, they will also have questions. On that note, we might have a second session with Dr. Siddharth. So do write in the comments what other questions you have. If we have enough questions,
Definitely.
back again on the podcast.
Definitely.
So again, Dr. Siddharth, thank you so much for sparing your time for this educational session, both for doctors as well as for those who are not doctors. And hope to connect with you again on this topic.
Thank you so much.
Thank
you so much for hosting me. Even I loved answering your questions.
Thank you. It was really great to have you over here. And thank you all the audience for listening to this podcast patiently, and do share it with everyone, because the only reason why we are doing this is so that we get the right knowledge spread across to people.